Hi, everybody. It's Carol Clark here, your bariatric business coach with Weight Loss Practice Builder, and I am so excited. I have a new friend and someone I met here at ASMBS. I can't believe I hadn't heard of you earlier.
I know.
This is Dr. Connie Stapleton, and she is a author, and she also does fabulous things for all of our patients, these weight loss surgery patients.
I can't believe I hadn't heard of you before because what you guys do is amazing. I had one of your husbands.
Yeah.
But I kind of like what you do better.
I have more fun, I think. No,
I think you do.
he has fun too. But I'm going to let Dr. Stapleton tell us a little bit about what it is that she does.
Well, I'm a psychologist. I've been in the field of bariatrics for at least 15 years, and I do at least 400 pre-surgical evaluations every year for people having weight loss surgery. But I work with people who are surgical weight loss or medical weight loss, focusing on the aftercare portion.
Right.
Because so much in life changes after somebody loses a significant amount of weight.
It's so necessary.
It is. And it's still left out.
Right.
I call it the critical missing element.
Right. I believe that's true. And you've written a couple of books.
I have.
Tell us about that.
Okay.
They
so
are
my
good.
first book was called Eat It Up. And it's kind of my baby. And I wrote it because so much of life changes when you have weight loss surgery. And people going in, of course, you want the surgery, you want that weight off. I get that. But I don't think people are always prepared for the changes in relationships and the changes in self-esteem and the changes in, your social events and your physical event, activity. Everything changes. And so I wrote this book to say, listen, when you have weight issues that are impacting your life, it impacts every area of your life negatively. And when you lose a lot of weight, every area of your life changes also.
Right.
So be prepared. Look at the fact that every area of your life is going to change so that you're not taken completely off guard.
Right. So do you also address then, I assume, some of the, accountability?
Oh my gosh, I'm huge on accountability. In fact, I have this acronym I call the 4 ACEs because the 4 ACEs is a great hand to have, right? But it's awareness, acceptance, accountability, attitude,
right,
commitment, effort.
Okay.
Because, you got to do the work.
Right.
The surgery does the weight loss portion. But if you want to keep that weight off and have that improved quality of life and improved health, you got to do a lot of work.
Right, right. So Eat It Up is one of your books.
Right.
And it also has a workbook.
Correct.
And does that start before surgery, afterwards? How does that?
It doesn't matter. It really doesn't matter because it's about looking at your life in all those areas of life. People who've lost weight have not forgotten what it's like prior to losing weight. So it doesn't matter where in the journey you're at.
Right. And I think, too, for, we have a lot of bariatric surgeons that follow this podcast and a lot of their employees, that sort of thing. But a lot of times you don't have time in the office to necessarily address that. So it's really nice, I think, to have a resource to be able to provide for your patients or send people to.
Right.
That's a nice thing.
A lot of practices have Eat It Up in their work, in their practice, and give it out as part of
great.
the preparation.
Right, right. And then what's your other book?
My other book is called Weight Loss Surgery Does Not Treat Food Addiction, which is really a controversial topic because it's not yet been deemed a disease like obesity has. But when I started in this field, obesity hadn't been deemed a disease either. So a lot of patients particularly will say, I know I'm a food addict. Without question, they feel like they're a food addict. So if people believe they're a food addict, or, and I'm a huge advocate of addiction and recovery, they got to be aware that when they go into the operating room, they're going in with the disease of obesity and the disease of addiction. Nobody's treating that addiction in that operating room. So when they come out, that brain is saying, feed me, feed me, feed me. And so people sometimes find themselves in trouble with alcohol or gambling or sleeping around or absolutely.
Right. And do you end up having to, I imagine you probably speak to addressing family members or their support people?
All the time because, it's a family illness. It's a family disease. Obesity is a family disease. It requires family, recovery.
I love, and you're so easy to talk to.
Thanks.
Yeah, I bet the patients love that. Now, there's one other thing we were talking about, and that is you even do retreats. Is that true?
I do retreats for women only because it's a very intimate setting. But we go, the retreats where we really dig into what's going on that maybe you can't follow through, you have struggled following through with, the behavior modification,
Right.
or, what's going on that you turn to food for comfort? Why is
Mhm.
food your drug? So we address regain and food addiction awareness.
And we probably have some healthy, appropriate eating.
Oh, it's
cooking there.
wonderful, wonderful, wonderful healthy food, no sugar, no simple carbs.
Yes. Yes.
It's amazing.
That sounds great. I want to
Mhm.
go.
Well, come on.
Awesome. Yeah. Sounds like lots of fun. Well, we are at ASMBS, and I am really enjoying my newfound friend, Dr. Stapleton.
I know.
Yeah, we actually
He's
met
in a
at
pod.
a book signing today.
Right.
We were both doing a book signing. So, and we have met some really fabulous surgeons here and health practitioners, dietitians, really, passionate about taking care of this population, even though we only are able to assist, or not, we're able to assist more, but we're really only impacting about 1% of the morbidly obese in America. Yeah, it should be more. So I am so grateful to have met you. And if
Ditto.
someone wants to reach out to you, how do they get a hold of you?
Well, I have a website. It's ConnieStapletonPhD.com.
Mm-hmm.
I have one called Fair and Firm Retreats, kind of known as the Fair and Firm. I'm not going to sugarcoat anything literally or figuratively.
Mm-hmm.
And let's see. Also on Amazon. My books are on Amazon and on my website. So
That's great.
yeah, I have a
Okay.
YouTube channel, all the social media.
Yeah, of course you do. Yeah,
It's a must,
it's a
right?
natural. So I am so excited. Thank you for joining me
You're
here on my
welcome. Thank you
podcast.
for having me.
You're
I'm
welcome.
so glad to know you.
Yeah, you too. So Build the Weight Loss Practice of Your Dreams is the podcast. If you haven't subscribed yet, then what the heck are you waiting for? Subscribe right down below.
Good. You're good.
They need to subscribe. And if you're not a member of Bariatric Business Boss, it is your connection for everything for building your bariatric practice. So go to bariatricbusinessboss.com.
Can I say
Join
one
me.
more thing?
Mm-hmm.
Since we're talking about building a bariatric business,
Yes.
I have a brand new aftercare program called Bari Aftercare. So it's BariAftercare.com. Please look it up because aftercare is so missing.
Mm-hmm.
And who has time, right? Who has time to address all these emotional components in your practice?
Right.
This program gives
Especially
it
if
to you.
you're here to help with that.
Mhm.
So I
Thank you.
love that. So everybody, we've got plenty of resources. I'm sure you have some free resources at your website as well.
Tons.
So check it out, website, and also my main website is weightlosspracticebuilder.com. So until the next time, we are going to say bye to you from Vegas.
Vegas.
Mhm.
Oh gosh, putting heels on tonight.
Yeah, we get to go to a party tonight, so we'll get to see each other there
Yes.
too. All right.
Thank you.
Thanks for being on the podcast.
You're welcome.
Everybody, take care. Bye.
Bye.